Will Mullins has been in the business of saving others' lives for 6 years as a Hampton firefighter.
This one exposure at work turned my family upside down.
In October, he contracted a nearly fatal case of COVID-19 after doing CPR on a patient.
Then I started coughing up blood, so I went to the emergency room.
He hasn't been back to the job since.
Because I didn't think I was going to make it. I was in the hospital for about 7 days. High flow oxygen, myriad of antibiotics.
Mullins was lucky. The city pinpointed directly when he contracted COVID, and he received workers' compensation. But hundreds of other first responders in the Commonwealth aren't so lucky.
Currently, the resources for firefighters that have COVID are very limited because it's not covered under the Workers' Compensation Act, so it's not treated as an occupational disease.
The Virginia General Assembly is trying to change that, but the version of the bill that is likely to pass is not retroactive.
Now these frontline workers are left with thousands of dollars in medical bills, and many of them with lingering health effects.
The bill, which passed in the House of Delegates, establishes a presumption that the virus causes death or disabilities to frontline workers. In the House version, nurses and firefighters who were infected with COVID-19 between March 12th and December 31st would be eligible for retroactive benefits. The Senate legislation would only apply to a person diagnosed with COVID-19 on or after July 1st of this year.
They continue to do what they swore an oath to do, and that is to save lives, risking their own health and safety.
The bill is in conference committees this week, with a decision likely by Friday. I'm Chelsea Donovan for News 3.